Though mental illness usually begins during adolescence and young adulthood, mental illness is experienced by people of all ages and cultures, from all educational levels and from all income levels. We know that 1 in 3 Canadians will experience mental illness in their lifetime. It has been reported that more than half of people with mental illness don't receive help for their disorders. In Canada, wait times to access mental health services can be long, and the challenges of accessing care may discourage those who are suffering from reaching out to the very solution that they need. Today's guest is a pharmacist and pharmacy owner from Victoria, British Columbia. Jason Cridge graduated from the University of British Columbia with a Bachelor of Science degree in pharmacy in 2012. He founded Cridge Family Pharmacies in 2013 and was awarded the Ben Gant Innovative Practice Award from the BC Pharmacy Association in 2018. In 2021, Jason Cridge founded the Cognito Health Mental Health Platform. Hello and welcome to Friendly Pharmacy 5. My name is Lindsay Dixon. I'm a pharmacist from British Columbia, Canada. And today I have Jason Cridge with me. Jason is an entrepreneur. He is a pharmacy owner, and he is developing an incredible mental health platform for Canadians that we're going to talk about today. Jason, thank you so much for joining me today.
Yeah, thanks for having me, Lindsay. I've been a big fan of Friendly Pharmacy 5 for a long time, and happy to be here with you.
That's great. Well, I wanted to just start out, Jason, because as a pharmacy owner, you have seen what's happened over the past few years in society as far as mental health goes, as far as access to healthcare goes. What concerns you most right now about healthcare in Canada?
A little bit about my pharmacy career. I graduated UBC in 2012, and I've worked as a pharmacist for a really long time. It was only these last few years where I've been kind of outside of the dispensary working on the business versus in the business. But in that 10 years that I've been a pharmacist and, talked to patients and worked with them at the counter and helped them navigate the system, I've just seen like a worsening of experience. As less and less people have access to family doctors, and those family doctors that are still practicing are becoming more overwhelmed. People are expected to navigate a super complex system, which is difficult when you're feeling well, let alone when you're feeling poorly, right? So I think patient experience is at all-time lows right now in Canada.
Yeah, and we are in a city in Victoria, British Columbia, where I think around 100,000 people don't have a family doctor. And we know people have increasingly complex health issues. So it's interesting for you to see that as a pharmacy owner. Does the amount of medications that people are taking concern you, Jason? Because some people will see you as a pharmacy owner and say, well, he loves dispensing medication. That's his business.
Mm-hmm.
But as a pharmacist, how do you see that?
I wouldn't find it concerning. Like, there are definitely some stats that are kind of surprising in Canada. As an example, Canadians are, I believe it's the highest usage rates of antidepressants in the developed world. And just to contrast that from the US, a lot of the mental health companies that have been founded in the US were connecting with customers through access to medications, whereas 85% of Canadians haven't cited access to medications as a barrier for mental health treatments. So I think it's kind of access to medications is less of an issue here, but I think it's just kind of access to holistic care. Like, it's one thing, calling a telemedicine platform and getting a 52-second refill call, because obviously there's no due diligence and there's no assessment that goes into calls like that. So I feel like the prescriptions are maybe, step 1, whereas they maybe should be step 4, 5, 6 in primary care right now.
Okay, so that leads us into the story of how you founded this company called Cognito, which is, my understanding is this is a fully integrated mental health platform. There are so many areas of healthcare that you could have gotten into or further into as a pharmacist. Why did you choose the area of mental health?
I think mental health was the one area that I kept seeing as a pharmacist where patients were just struggling to access care. And, family members of mine and friends of mine would try to access counseling resources in Victoria. And the way, most people did this, take out Google Maps, Google Counselor, and then call the first 20 people that came up. You'd leave 20 different voicemails with 20 different people, and one person might call you back within 2 to 3 weeks. And I can guarantee you the one counselor that had availability in Victoria like wasn't the greatest counselor out there. And they would also charge you $150 an hour for this service. So as we know from a lot of the studies and the evidence that's available, the best treatment for anxiety and depression is a combination of medication and therapy. But it was the combination of medication and therapy that patients were having a really hard time accessing. If you're one of those, 1 in 4 people in Victoria that don't have access to primary care, or you only rely on walk-in clinics, like what does your treatment pathway look like for, moderate depression or anxiety in Victoria? You're working 9 to 5, Monday to Friday, which means that probably on a Saturday or a Sunday, you're spending 3 to 4 hours sitting in line at a walk-in clinic. If that walk-in clinic already hasn't hit capacity, you're getting a prescription after a 2 to 3 minute appointment with a doctor who's seen 50 patients that day. You're getting it filled at a pharmacy. That medication hasn't even started kicking in yet, and you're expected to go back within 30 days to get a refill for that same prescription. So it's just a totally underwhelming experience. And when you combine that with the access to counselors in Canada, it's really difficult for patients to access this combination of medication plus therapy. So what we decided to do with Cognito is offer everything in the same platform. So you come in through our website, you fill out a PHQ-9, GAD-7, it gives you a preliminary diagnosis for depression or anxiety. So if you don't have depression or anxiety, you can decide, oh, well, I'm fine, I can move on. So that gives patients a little bit of kind of surety, and they don't have to sit there and in line for a physician's office just to find out that wasn't the case. After that, patients go to one of our registered psych nurses for additional screening. And we do screen out some patients that just were not well suited to handle, some patients who are maybe a little bit more severe or more complicated. And then we couple that with the physician diagnosis or nurse practitioner. We ship the medication straight to your door, and we start patients with self-directed courses. So like we have a course on cognitive behavioral therapy, and we have a course on postpartum depression, anxiety, and a course on insomnia. And what we're really hoping to do is really build out that suite of courses so patients can find a resource that's like uniquely valuable to them. And after all of that, patients start cognitive behavioral therapy. So yeah, CBT, super useful for depression, anxiety, and the preliminary results we're getting back are overwhelmingly positive.
That's incredible. And you mentioned a couple of questionnaires. You have people do I think you said PHQ-9 and GAD-7. What are those, Jason?
Correct. So those are like your clinically validated quantitative depression, anxiety measures that most primary care physicians and even pharmacists use to diagnose and then evaluate patients' depression, anxiety symptoms as treatment courses go on.
So by doing those, you're essentially kind of getting yourself ahead, right? You don't have to set up an appointment with a doctor to do this. You can just do this on your website, and it already gives you some great information. Is that right?
Yeah, absolutely. And I think the important thing about us having this information is that we're able to administer that exact questionnaire at 30 days, 60 days, and 90 days, and then give you an idea of how you're trending relative to what your first test was. Because if you were in, let's say you went to one walk-in clinic and another walk-in clinic and another walk-in clinic, you don't really have a trend of how things have either increased or improved or worsened during your treatment course for depression and anxiety. So with Cognito, it's nice because it's all in the same place, and you can even track your progress yourself.
Mm-hmm. That's excellent. And you also treat, so it's not just for depression, you're also helping patients, like you said, with anxiety, even insomnia. I saw something about ADHD. So as far as insomnia goes, I know that as a pharmacist, we see a lot of patients taking medications for insomnia, and we don't necessarily see them getting better. And sometimes they're even on medications that can cause even cognitive decline. So what made you think to add treatments like insomnia and anxiety together with this mental health platform?
Oftentimes, insomnia is not just, a symptom you experience in a silo. It can be, a symptom of depression. It can be a symptom of anxiety. And one thing that can be really helpful for that in terms of non-medications is cognitive behavioral therapy. So just helping you get out of those anxious thought spirals if you're not able to help your mind calm down before you go to sleep, etc. So that's why we decided that this combination of antidepressants plus CBT would also be useful for insomnia. And a lot of our patients have seen great benefit, even on the insomnia side, without sleeping pills.
And cognitive behavioral therapy, we're seeing a lot of success with this in a lot of different areas. As a pharmacist, I know this is not your specialty, but for those who don't know, could you explain to us a little bit about what cognitive behavioral therapy is and how it works within your platform? I'm also interested to know, have you seen any resistance to this kind of therapy with Cognito? Because we're not always as comfortable talking about these things. Some people would just rather take a medication and hope it goes away. So what has your experience been with that?
You know, I guess there's a bit of a bias with the patients that are using Cognito in that they are looking for a platform that offers both counseling and medication. So the patients who don't want counseling or don't want to try cognitive behavioral therapy are people we generally, I think generally those people stay away from our platforms. But the way cognitive behavioral therapy works is that your thoughts impact your feelings, which impact your behaviors, which impact your thoughts again. So what we're trying to get patients to do is basically get out of that negative thought spiral or that negative feedback loop by changing how they think about a certain topic. So whether, you know, you're anxious on the bus and you've got a reason that you're anxious on the bus, it's basically just like reasoning your way out of that anxious thought spiral, so then you can control the symptoms of your anxiety or depression yourself.
Are there patients that come to Cognito and opt not to take any type of medication? Is this an option for people that want to be a client?
Yeah, it's actually really interesting. So I thought the use of medications would be a lot higher, but what we found is about 50% of the people that are coming to the platform initially opt not to take medication and just want to try the counseling and the courses initially. But the one big thing for them is that they like that the option is there and that a physician is overseeing the whole process. That was a little bit counterintuitive to what I thought might happen, but yeah, the real world information has been quite interesting there.
Yeah, that's fascinating. And just knowing that there is that support there, like you said, overseeing what is happening, they know that, you know, should things kind of go a certain direction, they do have that support or the option of medication or talking with someone that can help them with medication. On the topic of medication, what about pharmacogenomics, Jason? What do you think about this and how this could relate to mental health treatments in the future?
We actually investigated using pharmacogenomics for every patient that came through Cognito. Because it is private pay, I thought this would be a great resource for patients to have, right? The information of what, you know, SSRI you're going to react the best to, or what anti-anxiety medication you're going to react the best to. But what we found is that the price points were just prohibitive, and it was difficult for us to really justify charging patients that out of pocket initially. I think a lot of patients are taking, you know, a leap of faith at the $99 price point, but if that was a $400 price point or a $500 price point, I think we'd have a really hard time getting patients onto the platform. But one of the unique things that we've opted to do is the interesting thing with Cognito is we're collecting more data on our patients' conditions and the type of interventions we're exposing them to, the type of demographics those patients have, and then the follow-ups afterwards. So in the next few months with Cognito, what we're going to do is apply machine learning to that data set. So then we can actually develop unique clinical insights. So, you know, let's say you're a patient that has certain demographics, you're of a certain race or a certain sex, you're experiencing these types of specific symptoms. There may be a medication and a certain dose and a course and even a counselor that would be better suited to you as an individual than just, you know, getting the gamut of medications. Because as of right now, the way most anti-anxiety and antidepressants are prescribed is it's just random mostly. Yeah. A lot of doctors just have, you know, they have 2 or 3 favorites and they just cycle through those depending on the patient. And it's because they lack resources to make patient-specific decisions because that information just doesn't exist. So we hope to develop a whole suite of information that's not only going to be useful for Cognito patients, but useful for patients worldwide.
Yeah, that's excellent, because improving how patients receive treatment and making sure they get the right treatment earlier when these people are already suffering is so essential, right? And it's a big gap right now. It's something that we really struggle with in healthcare. That leads me to my next question about treatment-resistant depression. Jason, how successful is current depression treatment?
I'm not going to know quotes from the meta-analyses like STAR-D, but
of
I
course
can tell you that as of right now with Cognito, we've been running an in-house study, and we're comparing patients at baseline when they come to Cognito and at the 90-day mark. And 90% of patients have statistically improved depression symptoms and anxiety symptoms at the 90-day follow-up mark. And like that vastly exceeds the different interventions that are available on the market right now, whether it's like just medication or just counseling. So I'm going to be really excited to see like the final results of the study and how everything pans out, because I think we're on to something super unique, and like we're getting it back from patients in reviews and feedback, and like everyone's just really happy with the service they're receiving on Cognito, which makes me feel great, and I know it makes the team feel great too.
Back to depression here, Jason. Side effects to antidepressants. A lot of people are very concerned about side effects and which antidepressant they're prescribed. Some people are more concerned about weight gain. Other people are more concerned about fatigue. How do your physicians decide which medication to use to treat a patient?
It's kind of patient specific, and it's provider specific as well. Like I said, most physicians and nurse practitioners have kind of a list of favorite antidepressants, anti-anxiety medications that they're prescribing. But yeah, like side effects is difficult. A lot of every single one of our patients gets a call from a pharmacist when we ship them their medications, and they counsel them on side effects and when to expect the like positive effects of the medication to kick in. And the difficult thing with antidepressants and anti-anxiety medications is you experience the side effects up front, and then the positive effects of the medications don't come until later after the side effects are gone. So I think it's really important that patients have that extra level of support, and they get that with Cognito. They get access to their physician and nutritioner. They get to be able to text with their pharmacist. They get meetings with their care coach every other week, and just helping patients through those initial days with anti-anxiety medications or antidepressants is really important to increase adherence and increase overall impact on the patient.
Mm-hmm. And Cognito also does help patients with ADHD. Now, ADHD, we're becoming increasingly aware that even a lot of adults are now being diagnosed with ADHD. Have you seen this, and how does Cognito help adults who may be suffering with ADHD?
It's difficult in BC and especially Canada because the diagnostic resources that are available to diagnose adult ADHD are very few and far between. So most patients are just, super frustrated. At one point last year, there was not a single diagnostician in Greater Victoria that would diagnose adult ADHD, and patients had to go all the way to Vancouver, and it would take like 1 to 2 years to get a referral. So, we saw like a massive need there, and opted to start bringing more diagnostic resources to market. So not just like repurposing diagnostic resources that were available in market, but bring new to market through upskilling nurse practitioners and GPs to, make the diagnosis themselves versus having to refer to a psychiatrist. We've seen a lot of success there too. And we hope to not only, service depression, anxiety, insomnia, and ADHD, but really expand Cognito's scope so we become the one-stop shop for all mental health conditions in Canada.
And how do you incorporate cognitive behavioral therapy for those with ADHD? And how could that help people with ADHD if that's the case?
Yeah. So instead of cognitive behavioral therapy, we actually deliver executive function coaching.
Yes.
Like ADHD coaches are, been around for a really long time, and executive function coaches help patients with ADHD develop a lot of skills that, you and I might have learned along the way, like using day timers or Google calendars or the different executive function skill sets that we've developed over years, maybe some patients with ADHD. And so Yet we still deliver that. They're 1 hour sessions once a month to our ADHD clients.
And just so everyone knows, how long have you been providing this service for, Jason?
So we did a soft launch in May. We started with just a few patients. We did an official launch in the fall, and so yeah, it's been about, I think since we officially launched, maybe 6 months, something like that.
And from your experience, are you seeing, are women more likely to seek help than men? Are you seeing certain demographics kind of stand out? Are you seeing some people that are a little bit more resistant? What have you observed?
Yeah, these numbers change on kind of the day-to-day, but
yes,
the experience so far has been women are more likely to approach us than men. And in terms of age profiles, it's mostly women between the ages of 25 and 35. I think a lot of that has to do with them being like digital natives, and they've grown up in using technology. And I think they're really comfortable with that. And then I think women are just more likely to reach out for help than men are. And maybe it's a little bit less stigmatized for women than it is men. So what we really do want to do, we know men are suffering too, and probably in equal amounts. So how do we break down those barriers around stigma, and how do we start connecting more with those patients versus just the women, which has been a huge success. And I'm really happy that we've resonated so well with that group. But we just want to make sure that we're an option for everybody, and not just one or two groups.
Yeah, of course. And you're just getting started out. You mentioned earlier that you actually have a course for women who are suffering from postpartum anxiety and depression. I'm really interested in that because when I had my kids, I could have used some support other than just, taking my baby in and, oh, baby's healthy and, oh, you look good, everything's fine. Okay, everything's fine. You've actually developed a course for people who could have supports after they have a child. Can you tell us a little bit about that?
Yeah, well, as a new dad, I've got a 2-year-old and a 4-month-old, and any parent is going to know how difficult those days with new kids are. That really was founded in the amount of women between the ages of 25 and 35 that we were seeing, and how many of those patients were new moms. And I think it has to do with accessibility. During the pandemic, it was difficult to get out and get into in-person visits, but when you have a kid and a baby, it's 10 times harder to do that, right? So I think the accessibility piece with Cognito is really important for them, but the feedback from our physicians and nurse practitioners and counselors was that, hey, we've got a big group here, and I think need to develop unique content for them specifically. So that course is currently in production, and we hope to have it done in the next few weeks here.
Mm-hmm. I love it. That's excellent. And I just want to clarify, Jason, is it true that all of these services that are being provided by Cognito, are these all virtual? There's no need for an in-person consult, is that right?
Yep, correct. So everybody comes through getcognito.ca, and they can do an onboarding right there. And oftentimes we have availability same day. So patients, if you're feeling motivated and there's, you want to take action, you come to our website, you fill out your assessment, and you'll be seeing somebody generally the same day or the next day, which is nice for a lot of patients.
No, that's great. It's very accessible for people. And Cognito is a subscription-based service. What caused you to make this a subscription-based service, and how has the uptake been for that?
Well, the uptake's been really good. We've seen huge increases in patient numbers. We grow anywhere between 50 and 100% month over month. I think it was just really important that it not be like an a la carte service where you're adding on, medications for $50 and you're adding on counseling for $100, and you want to subscribe to the affirmations, and that'll be $10. And what we wanted to do was try to provide as much value in that $99 per month package. So that's why we include everything from, visits with the counselors, to the medications, to the courses, to the daily affirmational text messages. And the reason we wanted to do it in a subscription model was just that this is the treatment that our providers have decided is the absolute gold standard for depression and anxiety. And so we want you to have access to everything. That's how we feel comfortable knowing patients are getting the best treatment available.
And right now, is it $99 a month? Is that right?
Yep, we offer escalating packages. So if you wanted more coaching, or you wanted to escalate to a registered clinical counselor, you can do that at higher price points. But the vast majority of patients are on the $99 per month package.
Do you see any third-party payers looking or are already paying for this at all, or any kind of some people have those accounts where they're like extra, I can't remember what those are called, but any funding at all? Yes,
yeah,
that's right.
Yeah, as of right now, like most of our focus as a team has just been on like building the product.
For sure.
So we haven't really gone knocking on doors yet for the third-party insurance providers, but it's something that's like high on our list of priorities to do next couple of months here. So although it's not available to be covered by insurance today, we hope that that changes within the next couple of months.
What can we expect to see from Cognito in the future? Where are you available? What's happening with Cognito these days?
So as of right now, we're just in BC, but we are expanding to the rest of Canada. So we expect to service the rest of Canada in the second half of 2022. So keep an eye out. We should be in your province shortly.
That's excellent. And Jason, for someone who may be suffering from anxiety or depression or insomnia, are there any red flags that you would tell them to watch out for that might mean that they should, maybe seek help, look at a service like Cognito? What could you tell people who may be watching and maybe thinking, maybe I actually do need some help. Maybe I'm having trouble dealing with this on my own?
I think the prospect of getting help is really overwhelming for a lot of patients. Mm-hmm. They're like, who would I even go to, or what would I even do? And I have to navigate this super complex system and go wait in line and go call counselors, and they just don't feel motivated to start. The nice thing with Cognito is you just go to our website and then you onboard, and we take you through the whole system, and we're the ones following up with you and touching base, and it doesn't require a lot of the patient. So I would say, like, if the first step to starting is even just thinking about starting. So if you're thinking about starting, like, feel free to reach out. We have availability today, and we can see you today, right? So there's not a lot of barriers to start getting access to care.
That's amazing, because that is usually a big problem, is where do I go? Who do I talk to? Is anyone going to take me seriously, right? So we've created this platform so we can do an assessment online. You can seek out the help that is there right now for you. So that's great, Jason. Thank you for being a pharmacist who is so caring and thoughtful about the mental health of Canadians. It's a huge issue right now. And so I invited you on the channel so you could tell us about Cognito and how it's really helping to improve the mental health of Canadians. So thank you for what you're doing. And we'll have all the links to Cognito, and I know you guys have a great blog and all of the things that we've talked about in the description of this video today. Thank you so much for your time, Jason. Really appreciate it.
Yeah, thanks for having me, Lindsay. Yeah, it's been great to be on the show.
That's great. Thank you so much. Take care.